So what are access controls and when to use it appropriately? Beg your pardon. So you will have seen this slide before when we touched on the organizational system security. However, in this context, we are referring to a clinician utilizing the emergency access function, which is only applicable if a consumer has set a limited document access code or a record access code, and there are rules around using this. So at document level, firstly, a consumer can choose to restrict access to a specific document in their MyHealth record. They can establish a limited document access code, which they can provide to the organisation that they wish to grant access to those particular documents. The consumer must set these from their own access point in their record, so they can do that on MyGov or on their MyHealth app. At record level, not document level, record level, a consumer can also restrict access to the whole record by establishing a record access code. This will mean only organisations given the code can access the record. Personal notifications to the consumer can be sent to show that a healthcare provider has access to the record. We touched on that one previously. These can be sent by email or SMS. This is a snapshot of what it potentially looks like from the clinician's end if they go into someone's record and it pops up with the emergency access button. The majority of patients or consumers nationally have not set any access controls. So you might think, well, what is the point of all this information if they're blocking clinicians from seeing it? So majority do not have any codes put on their record. So as a clinician, you can go in and view their record. It means it's not restricted in any way, shape or form. So in most cases, therefore, you will be able to see all the information possible. But for the purposes of healthcare, when would you need to use emergency access? Let's have a look at that. So in these particular examples provided, there are representations of what it may look like for a clinician if they enter into a record and a little message pops up and says, can you please provide the code? You will also note the emergency access button down in the far left-hand side. It is expected that the need to use the emergency access will be very rare, as emergency access to a consumer's record or a restricted document within it is only authorised under the MyHealth Records Act. If the healthcare organisation reasonably believes that either a couple of things have occurred. So the access could be necessary to lessen or prevent a serious threat to an individual's life, health or safety, and the consumer's consent cannot reasonably be obtained, for example, due to them being unconscious. Or the access to the consumer's MyHealth record is necessary to lessen or prevent a serious threat to the public health or safety. For example, to identify the source of a serious infection and prevent its spread. When not to use the emergency access. So the unlawful collection or disclosure of MyHealth record information, including via the use of the emergency access button, is subject to civil or criminal penalties as outlined previously. So when are you not permitted to use the emergency access function? So despite this being touched on just previously in other topics, we're going to expand on it here. So clinicians are not allowed to view their own record or that of a family member's. Consumers can access their own record via MyGov or via MyHealth app. Clinicians are not allowed to demonstrate how to use the emergency access function because there are training resources that are available to train how to use it. And clinicians are not allowed to check whether there are any restricted documents within the record. And we talked about it a moment ago. When an individual has forgotten the access code they have set, in this case, a consumer can reset their own access code by logging into their own MyHealth record or calling, there's a 1-800 number, 1-800-723-471 to reset it. Now, all of these particular scenarios in the early days of MyHealth record were factual accounts of doctors entering into patients' records for these exact reasons. The patient forgot their code, or they just wanted to be nosy and have a look what was in there, or because they put an access code on it and they didn't have the code available, they just thought they'd break glass and use the emergency access function. All of these were very seriously dealt with and recognised as potential issues. And so they've made sure that they've put some more stringent measures in place to prevent that from happening, a lot more education and awareness at the clinician level. So unauthorized access is considered a breach, of course. So managing a breach is part of your organization's compliance measures. So your organization is required to take reasonable steps and circumstances to protect personal information that is held within the MyHealth record. We're trying to prevent misuse of it, interference and loss of the data, unauthorized access, or any modification or disclosure. And these are all part of the Australian privacy principles that have to be adhered to by the organisation when they register for MyHealth record. So the precise steps that an organisation is required, I beg your pardon, to protect this personal information. Sorry, I've lost my spell. The precise steps that your organisation is required to take to the degree that is required will depend on your particular circumstances of your organisation. Now, there are 12 compliance steps that have to be gone through, and we're going to be talking about those a little bit later on. But if a breach occurs, you will need to obviously demonstrate that you know how to contain the breach and that you have evaluated any risks associated with that breach. You have to notify the system operator, which is the Office of the Australian Information Commission, and you have to take steps to mitigate any further breaches. This is a flowchart. It allows you to follow along to determine the steps. So if you have used the emergency access function, so irrespective as to whether you've used it inappropriately or whether it was a legitimate use of the application of using an emergency access, there are some steps that you do need to go through as well. So you will only be granted to that particular record for 5 days, and the access will close off. So as a provider, you need to keep a record of all the reasons for using the emergency access, rightly or wrongly. The system operator will be automatically notified when you use the emergency access, so that happens in the back end. And they will be contacting you without fail to say, please explain why this has been utilised. And if it's a legitimate reason, there's absolutely nothing to worry about. Otherwise, an investigation will occur. I'm going to be talking a little bit more about how to manage data breach in a moment.